Thank you, Chair, and good evening to board members. Some of you I sat beside last term. Suzanne, it's nice to see you. Nice to see you all. And thank you for allowing me to join you this evening. And thank you to Dr. Etches, of course, for your update. It certainly does provide some of the reassurance that residents in the city need after Friday's disastrous announcement of half measures that will do little, if anything, to stem the tide of the third wave of this pandemic. I felt compelled to appear at today's meeting because of the sheer volume of messages I'm receiving as a city councillor in response to the priority vaccine rollout. It's clear, obviously, from the delegates that appeared before me and the hundreds of messages that I'm receiving, that it is time for what Councillor Menard has coined a made in Ottawa approach. And while we don't necessarily have the immediate power to roll back some of the very misguided measures announced on Friday with respect to workplaces and restricting outdoors to people, we do have a responsibility as a city and you as a Board of Health to ensure that we continue to protect the most at-risk and vulnerable residents in our city with the vaccine that is available to us today. So with that, I believe that we must shift our approach today from what has been a successful age-based approach. But now for anyone under 50, that's got to shift to one of risk. We must vaccinate teachers, childcare, ECE workers, our transit workers, grocery store clerks, anyone who must leave their homes to work in public settings. We cannot vaccinate, and we know that. We cannot vaccinate our way out of this devastating third wave, but we can apply an equity lens to our approach that ensures that we're keeping the rate of infection in our city as low as possible. And you've heard tonight that people are frightened. Having paid sick leave for workers to stay at home when they are sick would have kept our transmission rate low, but the current provincial government continues to deny this one measure that would actually make a difference across the province. However, we know, we have the evidence that some 75% of community outbreaks in this city are connected in some way to workplaces, and they are mostly in the service sector. And it is in your control, Board of Health, to reprioritize the vaccine rollout for hard-hit communities and residents who have to go to work every day and are at the greatest risk of both infection and transmission. I think it's telling that just today, the CEO of the Queensway Carleton Hospital put out a message saying that 50% of COVID admissions that they are seeing in the Queensway Carleton Hospital are people of color. 50%. This means that our low-income residents working in precarious and service sector employment are disproportionately affected. I'll end with this. I live in Centretown West. We are a high priority neighborhood, but we're a high priority neighborhood because we have a large number of rooming houses. Take those rooming houses out, the rest of us are healthy, mostly wealthy, and we are protected and we stay at home. We're government workers. We are not at near the risk of others. But the 30-year-old childcare worker is at risk. And when that worker decides that she's not willing to risk her health and stop showing up for work, we will all quickly learn the definition of essential. Because once childcare workers, and that's who we've heard from tonight, once they stop showing up, other essential workers whose children they care for, nurses, grocery store clerks, they can't go to work. And that is when we will really learn what essential means. So I ask you to please consider prioritization of essential workers now, rather than continuing to move through the age categories below 50 years of age. At the very least, we need a registration system to ensure that we are at least capturing the data that we need to ensure that these essential workers, people who need to go to work every day, have all the information that they need to sign up as soon as they are eligible. We just can't leave people out there waiting. What happened on Friday, I believe, traumatized our population. What happened on Friday with the provincial government left us all with no rudder. You, the Board of Health, can provide that rudder.